Good morning, good afternoon, or good evening, everyone, and welcome to this webinar today. I am going to ask participants who are not speakers in the webinar today to mute their microphones to avoid background noise in the webinar today. Thank you very much. Thank you. So this webinar on testing and assessment methodologies today is about OECD alternative methods to the in vivo eye irritation testing. And we will have 3 speakers in the webinar today. And to introduce them, so first, we have Chantra Eskes, who is director of the Swiss 3Rs Competence Center in Bern, Switzerland. Chantra has been working a lot with OECD in the last 10 years for the development of alternative test methods, and also a guidance document that was published a couple of years ago, and she's going to talk about it for the use of the alternative methods. Then we will have another speaker, Dave Allen, who is president of the Integrated Laboratory Systems, ILS, in the United States. And Dave is also involved with some work at the OECD. He's a member of the expert group on eye irritation alternative methods. And Dave is going to talk about the usefulness and limitations of the alternatives available for eye irritation testing. And then we will have our last speaker for today, Bertrand Desprez, who is working at Cosmetics Europe in Brussels, Belgium. And Bertrand is going to talk about an ongoing project on 2 defined approaches for ocular toxicity predictions. So if during the course of the webinar you would like to ask any questions, you should do so in the chat box, and I will try to triage the questions, and we will have a bit of time at the end of this teleconference today to take a few of the questions raised. So now I will give the floor to Chantra Eskes.
Thank you so much for the presentation, Anne. And I will try to give you a little bit of an overview of the IATA in general. I hope that I will not take too much time. So before I start, I just wanted to say that the IATA is made mainly according to the UNGHS classification, which is similar to the European Union CLP classification, where you have 3 different categories for eye hazard. So the no category, the eye irritation, which are usually reversible effects to the eyes, and the category 1, which is serious eye damage or irreversible effects on the eyes. Just as a reminder, the effects for classification, they are based either on different tissue scores on the rabbit. This is the traditional way this was done. So depending on the score, you will have a category 1 or category 2 or no category. So very important, one major factor to classify category 1 chemicals in case if you have any effects that do not reverse after 21 days. So please keep in mind this irreversibility of effects, because I will come back to this later on the presentation. The 90s, the eye irritation was one of the first areas where a lot of scientists tried to work to try to find alternative methods, and there were a number of international validation studies in Europe, in the US, in Japan, that took place, but unfortunately they were not able then to replace the animal test method. And one of the reasons was that they realized that the in vitro test only partially modeled the in vivo response. There was also other reasons. One is the limited quality of the animal data, and I will again come back to this, and that at the time the statistical analyses were not sufficiently developed. Despite of this, the usefulness of a number of alternative methods have, however, been established. And for example, in the European Union, some of these methods were nevertheless accepted for regulatory purposes. Because of this, in 2005, sorry. So because of this, in 2005, there was a workshop that was organized to try to see how we could combine these different existing alternative methods to predict eye hazards depending on the range of irritancy and on the type of chemistry. And it was very nice. It was a workshop that comprised around 30 partners from different sectors, and there were two different working groups, and the two working groups arrived to the same conclusion, that it was important to have either a bottom-up approach or a top-down approach. So the bottom-up approach was, in the case the chemical is more likely not to be classified, then one will start with an in vitro assay that allow to reliably identify no classification or no category, and then use a second method to identify serious eye damage. And the top-down approach would be the other way around. This is now outdated. I just show it for illustrating how the things went because of this and the fact that we identified the necessity of having these two assays, one for the no categories and one for the serious eye damage. So the two extreme ranges of classification. Most of the validation studies that took place since then were based on this. And we have nowadays a number of in vitro methods that were adopted for what we call the top-down approach, so the identification of serious eye damage, or for the bottom-up approach, for the identification of chemicals that do not require classification. And you can see it's an extensive list. So there was the question, how can we combine these existing test guidelines with the aim of minimize the use of animals to the extent as possible, but still ensuring the human safety. As I said, the IATA is based on the UNGHS classification that I mentioned before. So this is a little bit how the IATA look. I guess you have already seen this. And what is interesting in the IATA document is that you assess the different characteristics of each of these information sources, and I will come back to this. Provides guidance on how and when to maybe those that do not talk should keep the microphone off. We have quite some noise now in the line. Hello? Yes, thank you. So, and it also describes the bottom-up and top-down approach that I explained to you with additional information. What is very interesting is that we have also considerations on the intrinsic characteristic of the animal data, and I will go through this. And it also describes some non-OECD adopted test methods. The guidance document was adopted in 2017, and the last revision was from this year, if I'm not mistaken. So this is a little bit how the IATA is comprised with three different parts. The first part is everything that is existing information. The second part is the weight of evidence analysis. And then the third part is prospective testing. And in this part of the existing data, we have what we call the 9 modules. But all of these modules, if they are here, explained by a level of complexity, but it's not a prescribed order. Anyone can use these 9 models in the order that they can, and if you have sufficient information, you may classify or not. But the 3 parts in the contrast, they should be followed in this prescribed order. I was just giving here some examples. Part 1 of the IATA, and I was saying that there is an example for example, about other existing animal and in vitro data. If you have, for example, an old existing in vivo test method, for example, FHSA method from the United States, you may use it to derive a final classification, which may be also relevant for the UNGHS. Otherwise, methods that are from those methods that I said that are accepted by the European Union regulatory agencies, like, for example, the isolated rabbit eye test, may be used to identify serious eye damage. However, negative results obtained with optimized non-OECD test methods might be used rather on a weight of evidence approach. To go for the next example, my computer. Then another example is, for example, the use of non-testing methods. For example, the application of bridging principles might be used to derive a classification of the tested mixture, which might include also identification of no category. In contrast, results from QSARs might be used rather on a weight of evidence approach. So as soon as you have sufficient information to derive a classification, you may do so. If not, you will use this information to see where you should go on the top down and bottom impression. There is an this is the top down and bottom up approach. And is very similar to what I showed to you before, but it includes additional information. For example, if here in the weight of evidence you can already, this is a non-category 1, you may overpass the first in vitro testing in the down approach. In addition, what we said is that here for the identification of category 1s, it may be relevant to use a second in vitro method to gain additional mechanistic insights, and similar for the methods that are used to identify no category. And the other point is here, when you do the top-down approach and you see this is a non-category 1, but you have sufficient information from the weight of evidence that says that this requires classification, you may also just overpass the second testing and immediately do a weight of evidence evaluation. And what I was saying, important to do this second weight of evidence analysis here. And when you really have a high degree of certainty, use the information to classify as category. So that is very important. If this is not sufficient, then you really need to go for additional in vitro method with non-adopted OECD methods, or in really case of necessity, then go for the in vivo testing. Okay. To describe the different modules of the IATA, my computer goes ahead. So the first one is the existing human data. In the case of eye hazard, it's a little bit different than the skin on that we often do not have standardized eye test, and of course we should never conduct eye test classification and labeling purposes. Usually these are existing data, but the quality and the amount of the data available is not always very good, and it's often associated with a high level of certainty. Only when the chemical has a clear and direct effect that can be associated with the test chemical of interest may be useful. That is why most often this is used on a weight of evidence approach. And what is important is that absence of incidents in humans will not overrule in vitro data or existing animal data of good quality. Okay. Then we have the module 2, which is the animal data. Yes, and it's important for you to know that the animal data has a very high degree of uncertainty. because you add the test material in the eye of the rabbit, and if it's a solid, you may wash after 1 hour, but otherwise it stays in the eye of the rabbit for at least 24 hours. And depending on the characteristics of the test material, this may be flushed away faster or slower. So in the end, you do not know the exact time of exposure to the eye. Secondly, if you have a solid material, that when the rabbit will blink, these solid particles may cause abrasion and could cause a secondary inflammation. So maybe the effect you measure in the rabbit is not really linked to the chemical, but to a secondary inflammatory effect that would not happen on us human because we would immediately wash our eyes. So there is a number of effects that can lead to variability in this animal test method. And of course, also the subjectivity of the allocation of the respective scores. And that led to a low reproducibility. There were a number of studies that were conducted that show that there is a very low concordance of classification between experiments of animals, so not even taking into account different laboratories, and that there is a number of chances of category 1 to be underpredicted as category 2, or category 2 to be underpredicted or non-category, and even 10% chances of a non-irritant to be classified as such, and another time be classified as serious eye damage. So there is really a quite high variability with the animal data itself. But of course, it has been used as the traditional means to classify. So this has its importance for classification. So now I will talk about the module 3. This is the OECD adopted in vitro test method. This is the table that you find in the IATA document. It summarizes a little bit the applicability limitations of these assays as well as the predictive capacities of these assays, either for the top-down approach, so the identification of category 1, or for the identification of non-category. There were recently some additional data that were generated on the applicability domain that Dave will be explaining in more detail, so I will not describe here. But also very important, this year we have a new test guideline on the Vitro gel irritation test. And there is also a draft test guideline under discussion on the ocular irritation. My computer, yes, this is it. But I think we will be discussing this into more detail. So very briefly, because Dave will also discuss this in more details. COP is an organotypic assay, which is based on the cornea of bovine eyes that are used in the food chain normally. And you place them in these holders and you measure the corneal opacity and the permeability of fluorescein dye. And based on this, you establish the in vitro irritancy score. And based on the outcome, you may detect it as serious eye damage or non-classification. I just listed it here because if you are interested, the overall data set used for the evaluation of this assay comprises 107 substances and 106 mixtures. And you can find all of this information in this OECD guidance document. And you even have the predictive capacity for different types of products or type of substance there. So I think it's very important that you check this when you use it for your own applications, how well this method predicts for your method. Another organotypic assay is the isolated chicken eye test. Here is the whole eye of the chicken that is used, like in this figure here, and there is a number of endpoints that are measured, some of them using a slit lamp like we would do for us human beings. And based on these endpoints, you derive an eye irritation classification and establish whether it's a non-category or serious eye damage. Also here you have a very extensive data set of materials that were tested, 75 substances and 109 mixtures. And again, you can check this information in the OECD guidance document 188, which was from 2013 and updated, if I'm not mistaken, this year or last year. We have a number of other cell-based assays. This is the short-term test Validation dataset includes 125 substances and mixtures. I will not enter into the detail because he's going to talk more into the details. We have the reconstructed human corneal epithelial model. This is mainly used for the no categories. And also here you have a very large data set that is between 100 to 200 test chemicals. Very interesting, in this case, you have often two different protocols for solids versus liquids, but I think Dave will explain this in more detail. Then we have the fluorescent liquid, which is here is just for the identification of serious eye damage. And the validation data set is a bit smaller here with 50 individual chemicals and 13 mixtures. Then we have the Vitro eye irritation test, which has just been adopted this year, which is composed of two parts, human corneal epithelium model and a collagen vitrogel membrane. And here, this is the trans-epithelial electrical resistance that is measured. So it's a different type of mechanism. And Dave will talk more into the detail. And finally, we have ocular irritation, which again is for no category and serious eye damage, but only for test chemicals that have a pH in this range of 4 to 9. And I think this is still ongoing at the OECD level, but there is already a draft test guideline adopted, if I'm not mistaken, guideline available, if I'm not mistaken. Just to summarize, so we have a number of in vitro test methods that are adopted already or accepted in some cases to identify the known category. We have a number of test methods adopted or accepted to identify category 1. Do not have yet any method for identification of category chemicals. And I wanted to explain you why, because when we started this validation based on this bottom-up and top-down approach, we wanted the method, for example, to identify category 1 that really reliably identify category 1, so that had a very low false positives or unacceptable false positive rate. But the compensation was that we had a low false positive, but then a high false negatives that then would go to be tested in the second tier, and that is the identification of non-classified chemicals, where here it was requested to have methods that have a very low false negatives, between 0 to 4. If you remember, I said the Draize itself can mispredict itself of 10%, so it's lower than the rabbit test. And but in compensation, these methods have a very high rate of false positives. So in the middle range, we have a number of false negatives from category 1s and a number of false positive non-classified chemicals. And in particular, for this false negative rates on the category 1, Else Adrians, she did an evaluation, and we found out that there is a number of the materials that are classified as category 1 that are found in various databases that are classified as such due to persistence of effects. I don't know if you remember the beginning of my presentation, I said that for category 1, you may classify it either based on the tissue score or based on irreversibility of effects. So there is around at least half of these chemicals that are classified due to irreversibility of effects in the rabbit. But the problem is that most of the in vitro methods, they were not developed to evaluate persistence or irreversibility of effects, but more acute effects. So that may explain in some instances why we have these high rates of false negatives. One thing that was done in the recent years is to try to identify alternative methods to cover this. And this was the work done by the detergent association industry, where they found out that when you use the isolated chicken eye test and you perform histopathology with histopathology, you see some effects that seem to correlate with the irreversibility of effects. For example, if you have strong erosion of your corneal epithelium, or if you have vacuoles that are formed in the lower part of the epithelium, these are effects that most likely will not reverse. And if classification is used based on identify. If we only use the isolated chicken eye assay, you will not identify any of the persistent materials, but with a histopathology, you strongly improve this. So this was introduced last year in the OECD Test Guideline 438 and in the guidance document 160. There are also other methods that are not yet adopted by the OECD that are trying to work in this sense to try to find alternatives to identify irreversible or reversible effect. One example is the porcine ocular cornea opacity assay. The other one is the EVITE, and both are also mentioned in the guidance document 263. Beside these methods, there are also a number of other methods that are mentioned here because they did underwent validation. They may be accepted by some authorities to classify the serious eye damage. They didn't make it to have an OECD test guideline. It's not yet. And so these are given as examples also in the guidance document, like the isolated rabbit eye, which is similar to the isolated chicken eye, but based on rabbit eyes. Head-cam assay, which measures the effects on the vascular system. The chorioallantoic membrane vascular assay, again, measuring effects on the vascular system. We have adaptations of the reconstructed human corneal epithelial models, specific for specific categories like antimicrobial and cleaning products. This is, for example, accepted at the EPA level. And then we have other assays which are cell-based or other assays that are still under development. But all this information is then found in this module 5 of the IATA. Finally, we have module 7 and 8. I did not talk about module 6 because this is existing data on skin corrosion, so I think it's a different subject. But for the physical chemical properties, this is mainly the extreme pH when they have a high buffering capacity. It's important to bear in mind that there are cases of extreme pH chemicals that do not induce serious eye damage. And the non-corrosive prediction of extreme pH having low or no buffering capacity most often require confirmation that is preferably conducted with a validated in vitro method. So it's simple and low cost, but it does not allow you to have full certainty about the result. But it does allow to identify chemicals that might have a potential to induce serious eye damage, taking into account this buffering capacity. Module 8 is non-testing method, and here for the substances, these are mainly QSAR with a cross-grouping and expert system, whereas for the mixtures, this would be bridging principles and theory of additivity. For the mixtures, that may allow to classify the compound if you have sufficiently good data on the similar tested mixtures and their ingredients. For the substances, this would be more an information to be used on a weight of evidence approach. And finally, we have the weight of evidence analysis, where it's important to conduct before any additional in vitro or in vivo test study is performed, and where it is important to consider the quality and consistency of the data, the adequacy of relevance of the information, the coverage of relevant parameters, and the consistency with other information. In the case of indicative relative a priori weight for the different types of information is if you have good quality and relevant existing human data, that would be expected to carry the highest weight. But it's also important that the effects on the human can be reliably attributed to the test chemical of interest. This is not the case. Then this is followed by in vivo and in vitro data with equal weights. And as a less intrinsic weight, there will be the other in vivo data which are not OECD, the other in vitro data which are not OECD adopted, skin corrosion data, physical chemical information, and on-testing method. And that the weight of evidence is also transparent. Information, if there is sufficient information, no further is required. If it does not allow a final decision, then it should orientate whether you will do a bottom-up or a top-down approach. What is also nice in this IATA guidance document, I don't know if you have noticed, but at the end of the document, you have an example of how a weight of evidence is conducted. And I think that can be useful for end users to see how to. So in conclusion, on the area of eye irritation and serious eye damage at the moment, I think we do not have it from the IATA point of view a full replacement, but we do have a partial replacement and are already allowed to reduce the number of in vivo studies conducted. This represents 6 to 7 in vitro test guidelines and 10 validated test methods. A testing strategy is clearly required for the full replacement, but there are still some challenges, which is the identification of the category 2 eye irritants and the stringent criteria that were put into these in vitro methods that led to these high false negatives and high false positives rates in the middle range. What would be very useful is to identify defined approaches that allow full replacement, and Bertrand will be talking about this, which is a very nice study, and also advanced models that covers current scientific gaps like the irreversibility of effects. And that's it from my side. I thank you for your attention.
Thanks very much, Chantra, for that very comprehensive and nice overview of the IATA that's available and all the methods that could go into that. So as Chantra mentioned, I'm Dave Allen. I work for a company called Integrated Laboratory Systems. Among the many hats I wear at ILS, one of my favorite and that I'm most proud of is that I'm the principal investigator for the NICEDM support contract at NIEHS. And I think most on the line are familiar with what NICEDM is, but just in case, it is the National Toxicology Program's Interagency Center for the Evaluation of Alternative Toxicological Methods, or as known as NICEDM. And ILS provides the operational and scientific support for NICEDM under a contract with NIEHS. And pictured here in the middle, Dr. Warren Casey in the purple shirt is the director of NICEDM. Dr. Nicole Kleinstreuer to his immediate left is the deputy director, and they are both NIEHS federal employees. The rest of the NICEDM group pictured here are ILS contractor staff. So just quickly, as we go through the types of methods available, and I'm going to focus on those that are current existing OECD test guidelines or in the OECD Test Guidelines program. And you can see the four major groups of those types of methods. Certainly the in vitro monocell, the simplest approaches, monocellular culture systems, moving to the whole organ or organotypic systems, and then the in vitro reconstructed human corneal epithelial models, and then lastly, as Chantra mentioned, the non-cellular and chemico methods such as the ocular ear detection, which is currently a draft test guideline. So certainly all of these methods have their place in their relationship to in vivo responses, and I just moved through those here with respect to the corneal epithelium. The full spectrum of the epithelium, stroma, and the endothelium. And then the corneal epithelium itself is modeled through the 3D reconstructed human tissue models. And then certainly the squamous epithelium, again, the simplest approaches are those monolayer. Okay. Okay. Are we still echoing? Okay, good. Chantra gave a nice overview of the bovine corneal opacity and permeability assay, and I'm going to try and catch us up a little bit. All of the information in these next series of slides are very nicely and detailed in the test guidelines themselves, as well as the guidance documents that Chantra made reference to. And of course, as Zan mentioned at the outset, the recording in these slides will be available to you. So I'm not going to belabor much of the information on these with the intent of getting us back on track and giving Bertrand plenty of time to go through his defined approaches. But certainly, as Chantra mentioned, the BCOP, it comes from a food production animal and can be used to identify either in a top-down or a bottom-up approach. So of course, it's not, it's not recommended for those mild or moderate irritants in the Category 2 GHS categories. It certainly cannot consider conjunctival or irital injuries because of the model itself. And certainly it doesn't provide the capacity to directly evaluate reversibility of corneal injuries. However, that being said, histopathology certainly can be used and as an add-on to the assay, and certainly can help in identifying those chemicals that would cause irreversible effects. And I'll touch on those towards the end of my presentation. The other quite familiar organotypic model, the isolated chicken eye, again, another food production animal source for this, this model, and again, can be used in both a top-down or a bottom-up approach, and it has the same limitations as the BCOP with respect to hazard categorization and its capacity for evaluating conjunctival or irital injuries. Again, and as Chantra mentioned in her presentation, there is a nice atlas for histopathology available for the isolated chicken eye and how that can improve performance. I should note for both of these methods, they have the one confounding perhaps challenge of the instrumentation, and the equipment is certainly not readily available in every laboratory. It's not common necessarily laboratory equipment in some cases, so it does require some upfit for the laboratory for some of the equipment. The simplest approaches, again, the in vitro monolayer cell systems. Certainly, many laboratories are familiar with cell culture. They're easy to conduct, so the techniques are already perhaps in-house, typically relatively rapid in the assays themselves, and often have simple endpoints, assay endpoints. Can batch test materials through these assays in 96-well plate format. Even using things as liquid handling, robotics, and scaling to medium and high throughput, conceivably. And of course, as opposed to objective scoring measures, you can have machine-readable objective scored endpoints. But certainly, one of the confounding issues is the challenge of trying to evaluate anything other than a monoconstituent substance in these monolayer systems because of the challenges with solubility and otherwise. So among the monolayer cell systems, the fluorescein is an approach that actually applies canine kidney cells, a cell culture line, and the focus of that assay is to measure of a marker dye, in this case fluorescein, to indicate disruption of cellular tight junctions, which of course would be an indication of damage to the epithelium. Of course, that thereby assumes that chemicals causing eye damage or irritation will disrupt the epithelial barrier function in the corneal epithelium and or the conjunctiva. Again, this is simply a top-down approach, so does not provide categorization for Category 2s. I should also have not classified on this slide as well. It's limited certainly to water-soluble. And you can see listed here a number of types of chemicals that fall outside of the applicability domain of this assay, such as strong acids and bases. Certainly things that are cellular fixatives would be problematic, as well as which are problematic. And noting that things such as colored or viscous substances might actually be difficult to remove. completely from the assay system, and of course confounding measurement of the permeable fluorescein. And finally, this cell line itself has been demonstrated through multiple passages to show as increasing passage number, those tight junctions become more and more compromised. So it's, the cell line itself is certainly not useful for an infinite time point. The short time exposure test is another monolayer cell system that uses rabbit corneal cell line, and it's a relatively simple cytotoxicity assay that simply provides a measurement of % viability relative to control cells or untreated cells. And of course, this is a correlate to eye damage with cytotoxicity in corneal epithelial cells. Again, this is a top-down or a bottom-up assay, so it doesn't provide categorization in the mild and moderate regions. Of course, it cannot be used for things that are insoluble or those that can't be uniformly suspended, and there's a metric for actually doing that in the assay. It needs to remain suspended for at least 5 minutes, and you can see the 3 recommended vehicles that can be used excuse me, in the assay. And then it also is limited to only solid surfactants. Other solid materials are problematic in the assay, and of course, as already mentioned, things that are highly volatile or have a high vapor pressure. This assay actually provides a quantitative value for volatility that fall outside of the applicability domain. So dilution-based assays themselves in monolayer systems, when you have to dilute substances like in the short time exposure test, certainly aqueous and soluble materials are problematic. Dilution or buffering effects in the culture media could actually mask the toxicity of the neat material. Of course, pharmacokinetics is problematic, and we're not modeling tissue barrier function as well. So moving into the 3D reconstructed human corneal epithelial models, or HCE models. These are reconstructed corneal tissues, theoretically would more precisely model corneas, the in vivo cornea and the monolayer cell systems themselves. Certainly you can mimic in vivo exposures to substances because you're directly applying to the surface of the air-liquid interface, as would be interacted with the cornea in vivo. There are certainly standardized manufacturing practices of these materials to ensure that the platforms are standardized. And again, the endpoints can be machine scored so that you have objective measures of irritation. So the reconstructed human corneal epithelial models are provided in Test Guideline 492, and you can see the models, which are the validated reference methods and the Me-Too assays that are currently included in 492. The most common being, and most often noted, being epiocular, the skin ethic HCE, the Japanese model, lab site cornea, and then the Korean model, the HCETM. And these are cytotoxicity assays. There's several different protocols available. In the guideline itself, it's a percent viability. There's also time to toxicity protocols that have been developed for other applications. And these assays are very good as a bottom-up approach, but certainly don't discriminate between the irritant categories as listed there. Those chemicals that, of course, would interfere with any of the viability measurements, like direct MTT reducers, which is the assay format for many of these, or color interference, there have to be controls in place to address those, so they can be dealt with, but could be a challenge. And certainly gases or aerosols are difficult to test in these assays. I believe the newest in the test guideline program would be the Vitro eye irritation test, which is, as the slide indicates, immortalized human cornea cells that are actually fabricated in a Vitrogel membrane. And again, this assay format is based on barrier function as assessed by transepithelial electrical resistance, and it's very useful in a bottom-up approach as indicated in the comprehensive validation study. Of course, that means it doesn't discriminate between the irritant categories, and it's limited only to those test chemicals with a pH greater than 5, and solids are problematic in the assay. And last but certainly not least, as I mentioned at the outset, a draft test guideline in progress is a non-cellular and chemico method, the ocular irritation. There are other assays and similar assays in development, such as the OptiSafe test method. These have the distinct advantage of not requiring specific cell culture facilities or culture expertise. There are relatively simple kits that are provided by the manufacturer, and thereby are, typically are relatively inexpensive, certainly standardized manufacturing processes as the kits are provided. But the distinct limitation for the irritation method is the pH range is somewhat narrow and the chemicals that are applicable to it, but it does have the ability to identify both top-down and bottom-up. So as Chantra mentioned, clearly there's a gap in the middle of the irritant spectrum. I can spend another hour talking about the possible reasons for that, but certainly one of the largest, as Chantra mentioned, I think would be the variability of the in vivo test itself. I'm not sure that this is a biological problem as much as it is a categorization problem, but that's a whole other discussion itself. So there's been a number of publications the past few years actually applying many of the OECD methods and other eye irritation methods and some of the challenges that have been experienced, or perhaps some surprising results or results that were unexpected based on, perhaps current knowledge of the irritation spectrum of some of the products. And this is probably best typified in the agrochemical space. So one of the things that NICEDM has done over the past couple of years is we were very generously donated from 5 different agrochemical companies over 200 data points, paired in vitro and in vivo data in agrochemical formulations in several different OECD and other eye irritation methods, with the idea of, can we come up with a defined approach using all of those data to accurately identify eye irritation for these types of formulations. And ultimately what we found was we didn't have enough data across multiple assays because each of the labs used their own testing approach. So the decision was made to do some prospective testing, and we looked across the spectrum of types of agrochemical formulations and chose the most common 3 across that spectrum. The goal really being here is there's something unique about these formulations that challenges the in vitro assays, or is there something that we can learn in this prospective testing about these products that would provide some insight. And you can see that the study design certainly balanced with respect to hazard classification. One of the key criteria is making sure that we had in vivo data that was as quote-unquote high quality as possible, meaning really definitive, what appear to be definitive results for the classification itself. And then the National Toxicology Program would code these formulations, distribute them to testing labs. Pictured here are the assays involved in the prospective testing, 3 within the Test Guidelines program, the BCOP, ICE, and Epiocular. And then a couple of others based on recent publications in the neutral red release, or Chantra mentioned the porcine corneal reversibility assay with the intent of perhaps identifying some of those formulations that act that induce irritation based on reversibility or lack thereof. generously donated formulations from the companies listed herein. And to date, we have tested 16 formulations, and I've got the EPA hazard category spectrum there because our initial focus is on EPA hazard classification, but we certainly are also characterizing GHS classification as we move through. And you can see the co-organizers of the study being NICEDM and the PETA International Science Consortium, and we have a number of stakeholders involved in this from our U.S. interagency committees and our partners within Europe, Canada, and of course our industrial partners. That this is a really wonderful example of the importance of public-private partnerships in these kinds of efforts. So, you know, what we've seen to date is none of these methods can identify all of the agrochemical formulations relative to their in vivo classification. However, the results across these first two phases of testing provide promise that we may be able to come up with an integrated approach that will accurately identify the hazard classifications of these substances. And I've provided an example there where the epiocular and BCOP combined with histology appear to be quite predictive in the first round, at least for the category 1 and the not classified substances. So we are in the process of finalizing the data analysis of these portions and moving into phase 3 testing. We're actually also in the process of developing an SOT abstract to present these data in more detail, so stay tuned for that. But our ultimate hope is that the study outcomes can be used to suggest endpoints to form the basis of a defined approach. And with that, I'll stop. Just a few important acknowledgments there. Thanks very much to Hans Rob at IVS for helping to prepare these slides. And on the far left here is Dr. Nipa Choksi, and Amber Daniel here just behind me have been critical to the eye irritation efforts here at NICEDM.
Thank you very much. Thank you, Dave, for this very interesting presentation. While we are moving to the next and last speaker for today, I would like to mention something that was brought to my attention about a number of times where the draft test guideline on ocular irritation was mentioned as a draft test guideline under development. Yes, it's been approved and it's currently under endorsement procedure at the OECD, and it should be available later in October or in early November as an adopted OECD test guideline if everything goes well. So we are moving to Bertrand Després now. Bertrand, the floor is yours.
Hello, Anne. Okay, can you see my screen?
Yes, go ahead.
Okay. So I'm Bertrand Després. I'm from Cosmetics Europe Science and Research Department. And in this presentation, you will see two different approaches that we have been developing for the eye endpoint. And I'm building basically on the presentations from the other speakers. So what you will know with this presentation is why we have some different approaches that are needed. That will be very brief. You will know what kind of different approaches are available, and you will know how we build different approaches, and more specifically, whether we can combine testing methods and non-testing methods that was shown in Chantal's presentation, how you can integrate physical properties in a bottom-up sequence, for example, and give you some examples. So as you have heard from the previous presentations, the UNGHS categories are newly implemented in the OECD Test Guidelines program, and for the moment, standalone methods can predict either category 1, the severe eye damage, or the no-cat, no category, no damage in the eye. But the intermediate category is still problematic, and it is mainly due to the variability in the Draize test, as Dave told you in the previous talk. So why we need different approaches? Well, if you have heard the first presentation from Chandra about the guidance document on integrated approaches to testing and assessment, the IATA, this document features a series of modules that can be used for trying to predict the whole spectrum of your eye endpoint. So, and if you have heard that you need to combine methods. So this document describes principles on how you can integrate several methodologies, both testing and non-testing, to predict the whole spectrum of the UNGHS. So what we try to do at Cosmetics Europe is to put this into practice and really try to integrate several methods and several data from several methods. And this is what it's the what part. This was reported in two papers, one for each different approaches. The first different approach is combining physical properties to a bottom-up approach that includes reconstructing human cornea and the COP LLBO protocol, and this is for neat liquids. And the second different approach that we have been reporting is combining HCE, short-term exposure test, with the BCOP LLBO protocol in the bottom-up approach, and this is for liquids, so both neat and diluted. So I'm moving to the how part, and I'll start with the bottom-up and try to walk you in the bottom-up approach. So the orange circle, this is a chemical that you have to test. If you start with the bottom-up approach, then it means you're using an in vitro OECD test that is suitable for no-cat identification, for example, the tests that are in the test guideline 492. If you have a negative outcome from this test, then according to the guidance document, you have identified a no-cat chemical. If you have a positive outcome from this test, then it's not a no-cat, but you don't know yet whether this is a cat1 or a cat2. It's a classified chemical, so it means not a no-cat. So you need to perform a second test, which would be an in vitro test suitable for cat1, because we have no suitable test suitable test for cat2, and that could be, for example, the BCOP method, as in the test guideline 437. If the outcome of the test is positive, then you have identified a cat1. If the outcome is negative, then it means it's not a cat1. So overall, we have not a no cat and not a cat1, which means you have identified the category 2 at the end of your bottom-up approach. So now moving to the non-testing different approach. Well, you can use, for example, the physical properties. So if you have a data matrix with enough data collection, for example, in vivo data from literature data, or if you have in vitro data that you're collecting, and if you have the sufficient amount of physical properties, then you're in a position of analyzing this data set. So that's what we did in our project at Cosmetics Europe. We used the in vivo data that was available from the literature. We used all the in vitro data from some validation studies, but we generated also some in vitro data for data gaps that we identified. And also, we looked at the physical properties. So you process all of these into a statistical, a very standard technique. It's called the principal component analysis. And from that, you can get a representation and quantification of the physical properties, and especially for the role regarding if you can separate, for example, liquid and solids, you can establish some relationships depending on the physical properties. Also, if you can consider some relationships with the UNGHS categories, and also with regard to the predictions that are made in the in vitro test. So I'll show this to you in the next slide, but basically you're in position to identify key physical properties with regard to your predictions and to optimize the bottom-up. different approach that I've been showing in the previous slide. So, for example, that is coming from different approach number one. That's available in the manuscript I showed you. So what the PCA shows you here, okay, it's not that complicated in the end. You can see here you have the liquids in black dots, and you have the solids that are well separated from the liquids depending on the physical properties that were chosen. So, for example, low vapor pressure is a high log vapor pressure is correlated with the identification of liquids, whereas high values of molecular weight or melting point are correlated with the identification of solids. Here on the right side, it's exactly the same plot. It's just that we have been putting, the different UNGHS categories. So we can see that we are able to separate liquid and solid on the left side, but on the right side, there is no big distinction between the three UNGHS categories. But still, we can focus now on some liquids predictions because you have identified some physical properties that are important, and here it's a plot for the kinetic HCE method. And basically, you can see on the blue dots the correct predictions that were made by the test, and also the false positive predictions and some unknown predictions. And when you look at this plot, you're able to identify the physical properties that are the most correlated with your correct predictions and the most important. So here we identified that water solubility was important, also the surface tension, the partition coefficient here, and the vapor pressure. And this is in view of a bottom-up approach. So in a bottom-up approach, you can start with a test guideline 492. And this is what is shown here in the different approaches. Number one, and there are 3 steps. I'll try to walk you through it and explain how it works. So in the first step, this is the non-testing part, and the second and third steps are the testing part. Okay, remember that was in the guidance document. So for the non-testing part, we have called it step 1, exclusion rules from physical properties. So basically, if you're able to verify that either your water solubility is below 0.02, or if you have a log P above 1 and a vapor pressure above 3 or a surface tension below 30, then you can conclude a prediction as no-cat based on the first step of physical properties. If none of these is verified, then you cannot conclude yet this is a no-cat. You have to move to the testing part of the test, of the different approach. And the one, as it's a bottom-up approach, then you can start with a method that is suitable for the identification of no-cat. So that would be, for example, the kinetic test or the ocular. And for example, you apply the prediction model of this test, and if the survivability is above 60%, if you find this, then you can predict that this is a no-cat. If your survivability is not above 60%, then it's not a no-cat, and you have to figure out by performing the BCOP. And we chose to perform the BCOP LBO, which use just different opacitometer from the one that is in the OECD guidelines. This is a laser light-based opacitometer, which is therefore not using the white light, basically. And we optimize also the prediction model of this laser light BCOP. If the opacity is above 145, then you have predicted the Cat1. If this is not the case, then along your different approach, you have not identified no cat, you have not identified cat1, so it means that you have identified the cat2 chemical. I'll give you some example. The first one would be the 1,3-D isopropylbenzene, and this is UNGHS NOCAT according to the Draize test. Okay, so we run step 1, and we were able actually to verify this exclusion rule. So we saw that the water solubility was below 0.02, and so it was predicted as NOCAT. It means that step 2 and 3 are not needed for the conclusion on this chemical. But for the record, just to tell you that the tests were correctly identifying the chemical anyway. A second example for this first different approach would be the 2-ethyl-1-hexanol. This is a cat2 chemical, and for this one, in the first step, we checked the exclusion rules from the physical properties, and they were not verified. We cannot conclude at this stage that this is a NOCAT. In step 2, we used both schematic and epicular, but you can use either of them. And the result was positive. So it's not a NOCAT. You're obliged to move to the next step, step 3, which is the BCOP again at the LLBO. And the prediction was that it was not a cat1, and you know the BCOP is suitable for identification of cat1. It was not a cat1, so it means that overall it was not a NOCAT from the first step. It's not a cat1 either from the last step, so it's a cat2, and that was a correct prediction. Now I'm moving to the second different approach. This is using the HCE test in combination to the BCOP LLBO. So basically, the first steps 1 and 2 can be combined. It's just relying on the outcome of the HCE test and looking at the concentration, the cell viability for the concentrations. We use a modified protocol that has been published and that is under consideration for adoption by the OECD. The modified protocol is really relying using mineral oil instead of aqueous solutions, and this is renders it suitable for highly volatile chemicals. So basically, you perform your HCE test, and if you have a mean cell viability which is about 70%, both at 5% concentration and 0.05% concentration, then it means you have predicted a NOCAT. If it's not the case, you look again more into details to your cell viability, and if the cell viability at 5 and 0.05 concentration is below 70%, then it means it's a NOCAT. If, for example, it's below 70% at 5%, but above 70% of solubility at 0.05% concentration, it means it's not a cat1. And you need to move to the next test, which is again the BCOP LLBO. And depending on the outcome of the LLBO, you will figure out whether if it's positive, then you have predicted a cat1. If it's not positive, it means it's not a NOCAT, it's not a cat1 either, so it's a predicted cat2. So here are some examples. This is the 2-methyl-1-pentanol, and this is a cat2. Well, the Draize test was identifying cat2. So in the first step, we looked at the cell viability, whether it was above 70%, both at 5 and 0.05%, and that wasn't the case. So here it wasn't a NOCAT. It's not a NOCAT. We look at the cell viability at again, And we saw that it was below 70% at 5%, but it was above at 70% at 0.05%. So this is not verified, and this is why we had to move to the next step using the opacity from the BCUP LLBO. And so we saw that the opacity, yeah, this is not well written. It wasn't above 145 opacity, so it wasn't a Cat1, and it was in the end a Cat2. For the second example, it's 2-hydroxy acyl ester, and this is a Cat1. So first step, the cell validity 70%, both 70% at 5 and 0.05 concentration. That wasn't the case. It wasn't a knockout. Same if we move to step 2, it was below 70% at 5%, but above at 0.05%. So we had to run the BCUP LLBO. Yeah, there's typo again, and here it was above, the opacity was above 145, and it was predicted as Cat1. I'm sorry that I put the wrong, I will correct this in the slide that will be shared with you. Yeah, and what's next? We have implemented these 2 different approaches in the OECD, and there's an SPSF, that is now under consideration and reviewed by the expert group on eye and skin irritation corrosion. This process is ongoing. Also, what's next in our pipeline? Well, you know, you heard that we worked on the liquids part, and now we are considering some different approaches for the solids, but this is still in development. So it's to be continued, I would say. Also, I'd like to acknowledge my team, my different approach team here, which are individuals from both Cosmetics Europe or Vitro, and also the lead country for the SPSF at the OECD, and our French national coordinator, and also the OECD Secretariat for the support. Thank you.
Thank you very much, Bertrand. I am left with thanking the participants of the webinar today, and also, of course, the 3 speakers of today for the huge work that has been put into putting these presentations together and sharing them and presenting them today. So thank you very much, Bertrand, Chantra, and Dave. And thank you, everyone. Have a wonderful day, a good weekend ahead. And I hope that you found this webinar informative. Thank you.